Welcome everyone. Thank you for joining today's session on ADHD medication for children and adolescents. Whether you're a parent, educator, healthcare provider, or just someone wanting to learn more about ADHD treatment, you're in the right place. In this session, we'll explore the different types of ADHD medications, their benefits, some pros and cons, and tackle some common misconceptions. We'll also look at the latest research on ADHD treatment. ADHD, or Attention Deficit Hyperactivity Disorder, is a neurodevelopmental disorder that affects about 5 to 7% of children worldwide. It's characterized by symptoms of inattention, hyperactivity, and impulsivity that impact a child's ability to function in everyday situations, such as school, home, and social environments. Medication is one of the primary treatment options for ADHD. When combined with psychoeducation, parental support and awareness, and behavioural interventions, medication can significantly improve a child's ability to focus, reduce impulsive behaviour, and promote better overall functioning. It's not a cure for ADHD, but it can be a powerful tool in managing symptoms. There are two main types of medication used to treat ADHD: stimulants and non-stimulants. Stimulants are the most commonly prescribed, as they are often most effective in managing symptoms. However, non-stimulants are sometimes prescribed when stimulants are not effective or cause unwanted side effects. Stimulant medications are the first-line treatment for ADHD and are effective in about 70 to 80% of children. These include medications like Ritalin, Concerta, and amphetamines. Stimulants work by increasing the levels of dopamine and norepinephrine in the brain, which helps improve focus, attention, and impulse control. While they are highly effective for many, they can cause side effects in some children. Non-stimulant medications such as atomoxetine, guanfacine, and clonidine are often prescribed when stimulants don't work or cause unwanted side effects. These medications work on different brain pathways such as norepinephrine or alpha-2 receptors. Non-stimulants tend to be less effective than stimulants, with about 50 to 60% of children responding well, but they can be a good option for some. Stimulant medications are often very effective, but they come with pros and cons. The pros include their fast-acting nature and high success rate. However, they can also cause side effects, such as appetite suppression, difficulty sleeping, or mood changes. There's also a small risk of misuse or dependence, especially if the medication is not properly managed. Non-stimulant medications have the advantage of fewer side effects and no risk of misuse. However, they tend to have a slower onset of action and may be less effective for some children. They can also cause sedation or mood changes in some cases, but they are a good alternative for children who cannot tolerate stimulants. There are a lot of myths and misconceptions around ADHD medication. Let's address a few common ones. Myth number 1: ADHD medication is only for severe cases. Medication is helpful for children with moderate to severe symptoms. It can also be used for children with milder cases who still struggle with focus and behaviour. Myth number 2: ADHD medications are just speed. While stimulants are a type of amphetamine, they are prescribed in much lower, controlled doses, which helps balance brain chemicals. It's not the same as recreational drugs. Myth 3: ADHD medications will change a child's personality. In most cases, when taken as prescribed, these medications should not alter a child's core personality. They help manage symptoms but do not change who they are. When a child may also have a comorbid diagnosis such as autism, stimulant medication can sometimes amplify certain behaviours, increase aggression, or exacerbate sensory sensitivities, for example. It's important to watch for this and report any concerns to your prescribing clinician. Myth 4: medication is a long-term solution, so no need for therapy. Medication is one piece of the puzzle. Behavioural therapy, educational interventions, and parent training are also important in managing ADHD long-term. Recent studies continue to provide valuable insights into ADHD medication. A 2023 study found that long-term use of stimulant medications might slightly impact growth in children, though the effects are minimal and typically rebound after medication is discontinued. A 2022 meta-analysis comparing non-stimulant and stimulant medications showed that stimulants were generally more effective, but non-stimulants were better for children who had adverse reactions to stimulants. Research also shows that ADHD medications, when used correctly, can significantly improve academic performance and behaviour in children. Medication management is an ongoing process. It's crucial for parents and healthcare providers to monitor the effectiveness of the medication, watch for any side effects, and adjust the dosage as necessary. Regular follow-ups with a healthcare provider are essential to ensuring that the child is getting the most benefit from the treatment. Sleep challenges are very common in children with ADHD. Studies show that 60 to 80% of children with ADHD experience difficulties with sleep. This might include trouble falling asleep, waking up during the night, or having restless, interrupted sleep. These sleep issues can in turn make ADHD symptoms worse, as a lack of sleep can impair attention, behaviour, and emotional regulation. Melatonin is a natural hormone produced by the brain's pineal gland in response to darkness, signalling that it's time to sleep. It plays a key role in regulating the sleep-wake cycle. Melatonin can be prescribed to help manage sleep difficulties, especially in children with ADHD who may have irregular sleep patterns or insufficient melatonin production at the right time. Melatonin can be helpful for children with ADHD by supporting their natural sleep cycles. For children who struggle with sleep onset, melatonin helps them fall asleep more quickly. It can also improve overall sleep quality by helping to regulate the sleep-wake cycle. This better sleep can in turn help reduce daytime ADHD symptoms like inattention and hyperactivity. Melatonin has several advantages for children with ADHD. It's non-habit forming, so there's little risk of dependency, unlike some other prescription sleep medication. It also has minimal side effects, making it a safer option for children. There is some evidence that it may confuse natural sleep patterns, however, so this is something to be aware of. While melatonin requires a prescription, with correct use, melatonin can significantly improve sleep and consequently ADHD symptoms like focus and mood during the day. However, there are some considerations and potential drawbacks. Melatonin may not work for every child, so it's important to be patient and monitor its effects. Timing is also key. Typically, it should be taken about 30 minutes before bedtime. If melatonin is overused or not timed correctly, it may interfere with the child's natural sleep patterns. It's important to note that melatonin is generally recommended for short-term use and should not be relied upon as a long-term solution for sleep difficulties. Before using melatonin, always consult with a healthcare provider to ensure it's appropriate for your child. It's also important to maintain good sleep hygiene. Set a consistent bedtime, avoid screen time at least an hour before sleep, and create a calming bedtime routine. Start with a low dose of melatonin and adjust as needed under professional guidance. Keep in mind that melatonin should be used as part of a broader ADHD treatment plan, including behavioural strategies and other interventions for managing ADHD symptoms. Next time we'll explore supporting ADHD children as they grow, preparing for adolescence and beyond. Thank you for taking the time to listen.